This is Limitless Spirit, a practical, inspirational, and thought-provoking weekly podcast about the impact of faith and Christian identity in today's world. And now here's your host, champion of Jesus and people who love him, world traveler and co-founder of World Missions Alliance, Helen Todd.
This is a special edition of the Limitless Spirit podcast. Our country is preparing for a gradual reopening of the economy. But do we have this pandemic under control? Are we ready to go back to our normal lives without the fear of going through another shutdown soon down the road? I have a special guest in the studio today, Dr. Richard Bartlett. He's a physician with rare credentials of practicing medicine for 26 years, but also having lab experience. He has discovered serious flaws in the current approach to handling the COVID-19 pandemic that he believes prevent a real breakthrough. He has also had a revelation that he believes was given to him by God of a simple treatment plan that he has used on his patients with great success. Hello, Richard. How are you? Thank you for being on the podcast. How are you and your family doing in these crazy times?
We are doing exceptionally well, and I'm also very encouraged. Even though it seems like the world has lost its mind, I feel like there's actually a rainbow at the end of this storm.
That is incredibly encouraging to hear. Just to get our listeners introduced to you, how long have you practiced medicine?
I've practiced over 26 years, and during the course of that, I've practiced in small town settings, in major level 1 trauma centers. I teach advanced trauma life support to trauma surgeons and ER doctors. I've been on the Health Disparities Task force appointed by the governor of Texas to give him advice on how to make equal access to quality care for all Texans. That was a 2-year appointment that he continued to reappoint me for a total of 7 years. We've been involved in leadership positions in the Texas Medical Association. I was on the bioethics committee, where our committee would make decisions on what was ethical and what was unethical to Texas doctors and hospitals. And we'll talk about that in a moment, how that touches on this crazy pandemic illusion that we're being fed.
So in 26 years of practicing medicine, do you ever remember a health crisis of these proportions?
You know, I've practiced while we had the SARS outbreak, while we had the H1N1. And for over 20 years, I was the medical expert on the local CBS News affiliate, CBS 7, which is for West Texas. And so I've seen a lot of things, but I've never seen the reaction that governments have caused. None of us have seen the reaction that governments have done with this particular virus. And we'll talk about why I think they're having that knee-jerk reflex.
Do you feel that the reaction is disproportionate to the actual threat?
Well, at first, I assumed they knew what they were doing. And, when you hear of quote-unquote authority sources like the CDC and World Health Organization, as doctors, we're trained to listen to experts, and we repeat what the experts say. And I'm still seeing that pattern, but there's another pathway of dealing with this from a separate source of experts and using critical thinking that would make our situation look totally different than it does today.
So let's talk about the virus itself. It is significantly different from any other virus known. So what is the main difference between COVID-19 and other similar viruses?
So there's coronaviruses, there's rhinoviruses, coronaviruses, and adenoviruses. Those are the classic flu viruses, or cold viruses, common cold viruses. But sometimes there's a mutation that happens in nature, like SARS, like MERS, where there can be a strain that's more virulent, more dangerous, and sometimes they come from animal carriers, vectors, like camels with MERS in the Middle East. You and I have both been to the Middle East many times on different trips, and also with SARS in China, and both of us have been to China many times. So those situations did not cause what we're seeing now. SARS-2 is what it's called. And that's interesting they picked that name because it has similarities with the coronavirus called SARS. And the naming of this virus came out of China. And I believe what's different, I'll tell you what scientifically and medically is different about this. I used to work in the lab. I was a medical technologist. I got my bachelor's in that and worked in hospital labs. Personally owned the highest level complexity lab that I was using in my office for years. And so I understand lab testing and lab work. I understand viruses. I actually am probably one of the few doctors that practices medicine taking care of patients that actually had experience as a lab tech working in a virology lab. So I know how hard it is to keep a virus alive and grow it in a lab and then be able to identify it. It's rather difficult because viruses normally are very delicate. And so they're very fragile normally and hard to keep alive. This virus, according to the source of the CDC, they let it slip that this virus could live for 17 days on a abandoned cruise ship. That's not adding up with science and medical information that I know and that is in the medical books. Normally, a virus can't live for more than 3 to 5 days outside of a human host. That's why the definition of a virus is an obligate intracellular parasite, because they must have a host to survive. And so what they were putting out as fact did not jive with what science knows with studying thousands of viruses and decades of information. So to take it from the start, SARS can't live for 17 days outside of a host. MERS can't live for 17 days outside of a host. Ebola can't live for 17 days outside of a host. This was the first time in history. Many people would not know that fact, but I know that fact, and there are many doctors and people who understand viruses that understand that that's a different fact. So how do you get, if it is a virus, how do you get a virus to live for that long? Well, something had to be changed with that virus, and we've never seen that happen in nature before. So that leads to the reality that cannot be denied, historical fact, that there is a level 4 bioweapons lab that was set up in Wuhan, China. The highest complexity lab for this in all of the nation of China happens to be in Wuhan, in the region that this outbreak came out of. And we have Representative Tom Cotton from Arkansas who called this out very early, that we need to have some answers, whether this is a bioweapon, whether it's a virus that was manipulated in a lab. I got to say, I've never, with what I just laid out to you, a virus that can live for 17 days. And then if you'll consider, in all my years and in the history of the United States, we've never shut down our country and the whole world. Every government that gets inside information, they know more than we do, to shut down their country and have such an extreme, fearful reaction of this virus is another interesting fact. It's a reality that we haven't seen shut down like we are experiencing right now, which is at great expense.
Okay, let's talk about who is actually at risk for developing serious complications from this virus, because you believe that the criteria set up by CDC is flawed.
It's actually false information. It's invalid. It's inappropriate. It's leading to needless deaths. And I will explain why. I'll just give you an example. The CDC, every county health department and every county hospital is giving the blanket statement that we are following the CDC criteria for testing and for treatment. The CDC criteria, when you listen to and you look on the CDC website, it's constantly using as its source information from the World Health Organization. If you look at where the World Health Organization is quoting its information and praising the source. It's the filtered information from the communist government of China. And so there's the trail. And anyone who wants to fact check that can look. And it won't take you 5 minutes on the internet to see that when Dr. Fauci is quoting the CDC, that they're quoting the World Health Organization, and that is quoting and praising the filtered information out of the communist government of China. And so that's one track. What is the fruit of that? Well, it's not working. We can see that Italy followed that information. Look at Italy. It's a disaster. It looks like a war zone in New York City in the ICUs. That's because they're following that criteria. So what is that criteria? They're telling my patients that I send to get tested, well, you don't meet the criteria because you have to have a fever and you have to have a cough and shortness of breath. They used to say that you have to have international travel as well, but they dropped that because that was shown to be ridiculous. Even though that was CDC criteria, people were dying that didn't have international travel.
That was early on. I don't think that's the case now. So what is the criteria now?
That's no longer a fact. Yeah, that's no longer required now. Now they're still requiring, according to the CDC criteria, a fever and cough and shortness of breath. So let me tell you, the first death in the county that I practice in Midland County of Texas, United States, did not have a fever, did not have a cough and shortness of breath. He had only one symptom, which did not meet the CDC criteria. He had diarrhea. And he went to a freestanding emergency room, which had some test kits, and did that testing. That was very audacious of them not to comply with the CDC criteria, but they uncovered a fact that you can have other symptoms. And it's been in the information coming out that at least 50% of the people that have coronavirus have GI symptoms. And so we know that. So
did he die of specifically COVID, or did he have a pre-existing condition?
COVID-19 died. He had no pre-existing conditions.
So he didn't have any other pre-existing conditions?
He was a 61-year-old pilot with no pre-existing conditions, no health problems, on no medications because he was healthy. Now, here's why you're seeing this happen. We're seeing a skewed outcome. It looks like a war zone in China. And it's because, okay, first of all, let's just say China has never been the leader in healthcare in the world. Why are we going with their leadership now? Boris Yeltsin came to the United States to get his bypass surgery. He could have gone to China. He was closer to China. Why is the United States making decisions based on information out of communist China now? Let me just say, this was a 61-year-old healthy man who, if he would have been tested early and treated early, might be alive today. And I'm going to tell you, when you delay treatment for an infection, let's say someone gets bit by a dog, and we tell them, stay home, here's the CDC recommendation. Stay home if you have mild or moderate symptoms if you're infected. Only come to the emergency room and seek help if you're having severe symptoms. We don't do that with any other infection. If someone has a dog bite and they have an infection, they get cellulitis, and then they wait till they're really sick, they're short of breath, they're fever, and then they come to the hospital, you're going to get a skewed outcome. You're going to have more people die. You're going to have more people have incapacitating results afterwards from the morbidity. That is exactly what we're seeing right now. This is a respiratory infection. I'll give another example. If someone has the flu, we have no.
You said it's a respiratory infection. So COVID-19 is not actually a virus. It's a respiratory infection?
Yeah. COVID-19 is a respiratory infection with a virus like the flu. And we never tell people, if you have the flu, wait till you're deathly sick to seek help in the emergency room. We don't make these restrictions to testing, and we don't make these arbitrary out of communist Chinese filtered air is where this information these decisions come from. We don't say, wait till you're extremely sick to get treated. If you do that, you're going to have the outcomes with COVID-19, a respiratory viral infection, but it's not an ordinary respiratory viral infection. This is another clue. It's not an ordinary virus, that it has been manipulated. Because what's killing people with COVID-19 is not just what we normally see with the flu, another parallel respiratory viral infection that kills people. With the flu, they get secondary bacterial pneumonia, and we know exactly how it's going to go. They're going to get ARDS, respiratory distress syndrome, and then they might get septic. With this, what's killing people is not the pneumonia. It's what we're calling a cytokine storm, where inflammatory cascades of chemicals are being released in an exponential form, where one chemical is released and then it triggers the release of many more, and it multiplies these inflammatory chemicals in the body that lead to multi-organ failure. Kidneys fail, the heart fails in people that are young or old. If it's not tested early and treated early, you don't have to have a comorbidity. I believe there's genetic tendencies for people to have their immune system go haywire, overreact, be triggered by this virus to have an overwhelming reaction to it that's releasing inflammatory chemicals that causes multi-organ failure. This is well documented.
So can people be tested in advance for these tendencies to know who's at risk?
Well, here's what needs to be done. Iceland has 10 people as of today that have died in the country. What they're doing is they're testing anyone that wants to be tested, even if they're asymptomatic, and they're finding that 50% of the people they test are positive, are asymptomatic. Those people, if they come to the United States, the health departments, the county health departments of every county in the United States and every county hospital would not test them. And they would test positive, and they would actually be contagious because they're testing positive with the antigen. So we have people, the Stanford study that is already being attacked because it's uncovering a reality that I am seeing as boots on the ground as a healthcare provider, that this disease is much more widespread in the United States than is being purported. And I'll tell you the reason why it's not an accurate number that's being told to us is because they're refusing to do testing like Iceland is on asymptomatic people. Or here's another example. I have 2 patients that tested positive, a husband and wife, who have been quarantined for 30 days in their house. The wife ended up in the ICU on a ventilator, we'll talk about in a moment. And they came home, and these 3 children at home, the health department has refused to test them because they're asymptomatic. That's illogical. I decided, despite what the CDC says, I'm going to check those children. 2 out of 3 tested positive that they are asymptomatic, but they are contagious. That is significant information, because if you know who's contagious, then they can self-isolate, they can be treated, and you're preventing the spread of the disease, whether it's in flu virus or whether it's COVID-19, which has been highly hyperinflated. We're seeing skewed information. They're waiting till they only get critically sick people to start with, and then they're seeing the percentages of terrible outcomes be greater because they're waiting till people get critically ill. That is by CDC criteria. Don't come to the hospital and don't seek help unless you are very sick. If you have mild to moderate symptoms, quote unquote, then don't seek help. Don't go to the hospital, self-isolate. That's a terrible plan for the flu. That's a terrible plan for strep. That's a terrible plan for any disease. But it certainly is a bad plan for this disease because there are people I know of that are young, that have no predisposing conditions, that are having serious problems. And it's probably a genetic tendency to having this cytokine storm started that leads to kidney failure and heart failure. And so
as a healthcare provider, you have actually run into multiple challenges trying to treat your patients. So what were some of these challenges? And actually, how many COVID patients have you diagnosed in the last couple of months?
Well, let me start with your first question. The obstacles that I've overcome, that I've run into, taking care of patients with COVID-19, which I am taking care of. I've got some positive tests that came back today. And so The first obstacle when you're a doctor dealing with COVID-19, there's two things you can do. One, you can test for it. Second, you can treat it. There are arbitrary, man-made obstacles to the testing, and there are arbitrary, man-made obstacles to the treatment. And what that amounts to is causing a delay in treatment. And so what happens is if you treat a disease, any disease, early, let's take cancer. You treat it early, easy, easier to take care of. You let it go to stage 4 metastatic cancer, disaster, probably, most of the time. You're skewing the results. So the obstacles I've run into, I send a patient to the ER on a Sunday night and tell them you have the symptoms of coronavirus, COVID-19, and you want to be treated and tested. They go to the hospital, and the hospital sends them away.
Excuse me for interrupting you, but is the hospital, the ER, is it the only place where people can get tested in Texas?
Well, today, I had to have someone drive 4 hours to a facility that was willing to do the testing because I asked for the testing and did not send the patient away because they didn't meet the CDC criteria. So I had a patient today that drove 4 hours one way in Texas to the only facility I'm aware of that will do the testing without meeting the CDC criteria. He'll probably test positive. So yes, if you go to any county health department, if you go to any county hospital, even though those are supported with your tax money, if you're an American, you will not get tested for coronavirus unless you meet the arbitrary CDC criteria for testing, which I have proven and has been proven by others to be invalid. The second thing is the treatment. Interesting that our President Trump spilled the beans during a coronavirus update meeting when he gave a press conference. He said, here's 2 medications in combination that can be used, and they might work. Immediately, that was shot down by Dr. Fauci saying we need more research. There needs to be research. I was shocked when I saw there was research in 2004 that can be easily found by anybody, and in up to 2018 with those medications showing that they decrease the viral load and they blunt the cytokine storm, the inflammatory reaction. That information was out there. Surely he knew that if he's such an expert. So yesterday, no surprise, he's with the NIH. And so yesterday, information came out of the NIH saying they've done the research and it doesn't work. Plaquenil is not effective. So interesting that he is with the NIH and he's against it from the beginning. And then it's from the NIH that we get this negative report about this one possible treatment. So President Trump offered 2 medications in combination that might be a treatment plan that have evidence in literature and research that they are effective against viruses, SARS virus. Interesting. And it's shot down. Well, the governor of Texas, right after President Trump announced that, the governor of Texas, Governor Greg Abbott, who I think is a great person, on a Sunday, he doesn't work on Sunday. On a Sunday, he sends out an executive order right on the heels of President Trump spilling the beans on that treatment saying and it was sent to pharmacies and to doctors. And this is not in the mainstream news, but every pharmacist in Texas and every doctor in Texas is aware of it at this time, that the executive order said no pharmacist can fill the Z-Pak, azithromycin, and Plaquenil unless they get a written prescription from a doctor with the diagnosis of coronavirus. That has never happened before. That's unprecedented. That's taking the medications out of the doctor's hands that are seeing the patients, that have a relationship with the patients, that might have some insight into what's going on with that patient. And it's, I wonder, is he stockpiling the medication? You would think the valid reason in his mind from his advisors is that we need to have the medication for the people that are truly ill, that have been proven to be ill. Well, the problem with that is you're not able to empirically treat somebody who you think has the problem. The test that I'm able to order is a 2-day turnaround. That's 2 days where people could get sicker and sicker if they're not treated. The other testing that's offered is 5-day turnaround. That's 5 days. People can get deathly ill in 5 days if they're not treated. So it's delaying care is totally appropriate to empirically treat someone when you have good judgment and evidence that they probably have COVID-19, which is supposed to be extremely dangerous. You shouldn't wait 5 days till you get a positive result. His executive order from the capital of Texas is an obstacle to the treatment. So I've run into obstacles with testing. I've run into obstacles with treatment, and I have evidence with patients, as do many other doctors, that the criteria that the CDC is setting for the testing is wrong, is invalid, is ridiculous. And
so let's go back to the couple that exhibited the symptoms of COVID, and you sent them to the ER. What happened to them?
So they work for a company, and I run the medical clinics for this oil company. And he was an employee. He had some symptoms he was worried about, so he contacted his supervisor and told the supervisor, you could talk to the HR. And so they asked him if it would be okay if I called him and spoke with him. So I spoke with him. His symptoms were consistent with COVID-19 coronavirus. I told him on a Sunday night, for you and your wife, since she has similar symptoms that he told me about his wife, and she had a history of asthma, and she was having shortness of breath, I said, you don't want to wait till the next day. You need to go to the emergency room tonight because that's open, and tell them, because I know they can do the testing, that you need to be tested. So he goes to the hospital. He's met by a nurse in the ER, and he's sent away. She says, if you're here for testing, you're going to have to wait and go through the drive-through testing in 3 days. We don't do testing.
So how did she not meet the criteria if she was exhibiting the shortness of breath?
So you're exactly right. It was totally inappropriate, and the history proves it. The outcome proves it. So they call me as they're driving home. I said, turn around and be insistent. Don't take no for an answer. Make sure they take care of you and your wife. Your wife is at great risk. He goes back to the emergency room. He tells them, I want to be tested and treated. He says they look at him and give him a sideways glance, and they're disappointed that he's back, but they have no right to send him away if he's not willing to leave. So he goes back to the ER. He calls me from the ER and says, we're in 2 different rooms, and they're not going to test either of us, they said. I call the ER doctor, speak with him. He assures me he's going to do testing. They call me a second time from the ER saying it doesn't look like they're going to test us. I talk to the ER doctor again. He assures me he's going to. I get the report after that they've left the hospital without anything but a albuterol inhaler for his wife. And this is...
so do you think the hospital is short of tests? Why would they not test her?
There is not a shortage of tests at this point. There was for the first 3 months, and President Trump addressed that. And now we have unlimited testing available in the United States.
And when did that specific case take place? Was it within the couple of weeks?
This was 3 weeks ago.
Early April then.
Yes, early April. And so at that point, there was unlimited testing available, except for this man-made, arbitrary, inappropriate, ridiculous obstacle to testing requiring these criteria. And and if they would have followed even that, the wife would have gotten tested, but they refused to test both of them. So 3 days later, they drive through the drive-through testing, and after that, they get a positive test result. But at that point, the wife who has underlying asthma is brought to the hospital and needs to be intubated.
We will pause here for now. In the next episode, we'll talk with Dr. Bartlett about his simple treatment plan that came to him in a dream. We will also talk how he has successfully used it on his patients, and also what needs to be done in order for our country to return to our normal lives with confidence. Until next time.
Thanks for listening to Limitless Spirit with Helen Todd, produced by World Missions Alliance. Are you ready to step out of your comfort zone? Do you have a passion to help people and share your faith across the globe? Visit our website, rfwma.org, and get involved in the Great Commission through short-term missions. We hope you'll leave a review and check out other episodes. We'll be with you in a week on our next episode of Limitless Spirit.